and developing empathy skills in autism spectrum disorder. In our daily life, we may encounter people with different psychological characteristics. In order for us to communicate more effectively, we need to understand the important concept of theory of mind. In this case, we meet some interesting questions. How can we ensure that a person with autism spectrum disorder engages in more effective mutual interaction? Is it possible to achieve this without emotional recognizing, without emotional awareness? For children and adolescents with autism spectrum disorder to demonstrate appropriate behavior and expand their social interactions, it is crucial to develop their understanding of emotion and instill a sense of empathy. Without these skills, it is impossible to imagine quality communication. For instance, imagine you are sad and you tell the person in front of you, and they don't understanding your sadness, and they start talking about their own needs. In this case, you would not want to communicate with that person again. That is why I want to emphasize the importance of this research. According to Plotchik's approach, there are 8 basic emotions: fear, joy, sadness, surprise, anger, trust, disgust, and anticipation. First, these 8 emotions should be introduced to the child through facial expressions, body sensations, and labeling. This can be done with various pictures cards and story cards. And most importantly, the emotional states experienced by the individual during the session shouldn't be overlooked. Their feelings should be labeled. Initially, we create a natural environment like this to show the person this important 8 emotion and help them learn them. In later stages, we use cards, stories. In other words, we evaluate every station where emotions are experiencing to introduce emotions. Without recognizing emotions, it is almost impossible to build empathy. Empathy includes 3 components: cognitive empathy, emotional empathy, and empathic concern. Cognitive empathy is the ability to understand what the other person is thinking. For example, you are talking to someone, and from their body language, tone, facial expression, you can guess what the other person thinks about you, the topic you are discussing. The key question for cognitive empathy is, what are they thinking? If I show you a picture and ask you, what do you think the person is thinking? You would look at the picture and make general assessment, give me an answer. An answer. I won't use this picture. In this picture, there is an umbrella, but no rain. The children, when see umbrella, their automatically response was, it is raining, but it wasn't raining in this picture. They simply associate the umbrella with rain. To give a correct answer, they will understand body language and hand movements. Body language, facial expressions, hand movement is a prerequisite for cognitive empathy. Without knowing this, it is impossible to guess what the other person is thinking. We develop these skills both in natural environment and with cards. Of course, natural environment are more effective. For example, we can start with some simple hand movements. We show the person movements like come, go, sit down, stand. I don't know. The key question here is, what am I saying? Then showing these hand movements. Emotional empathy, the key question here is, what are they feeling? Of course, to know this, we must first teach them to recognize and label individual emotions. This skill can also taught both in natural environments and with cards. Empathic concern, knowing what a person is thinking or feeling, doesn't necessarily mean we have fully emphasized it. And the key question here is, what can I do? For example, you see someone in helpless station, you understand what they are thinking or feeling, but what can you do to help them? It is important moments. There are important prerequisites for teaching these skills to individuals with autism spectrum disorder. Can we set these skills as goals for any individual with autism spectrum disorder? Of course, no. There are essential pre-skills such as joint attention, symbolic play, and speech skills. These skills are taught early in the rehabilitation process. If they are achieved this stage, then we can begin teaching theory of mind. From what we have discussed so far, it is clear that in order to build empathy with others, we must first accept that others have thoughts and feelings. As we know from psychology, people think egocentrically up to a certain age. For example, a child might assume that because they don't like pasta, no one likes pasta. Typically, egocentric thinking dominates between ages 2 and 5. So how can we teach them that others have their own thoughts, opinions, and feelings? This is a very famous picture. Another important point in communication is the metaphors we used. Individuals diagnosed with autism spectrum disorder particularly struggle with understanding metaphors. According to Brunner's theory, cognitive development passes through 3 stages: inactive, image-based, and language-based or a symbolic period. And it is third stage, symbolic stage, that understanding metaphors and proverbs happens. Of course, developing this skill in individuals diagnosed with autism spectrum disorder is not easy, but it is not impossible either. First and foremost, they need a broad vocabulary base. Thank you for your attention.